Good morning. Good morning, and I want to welcome all of you. I'm Victor Dzau, the president of the IOM, and I think it's, to me, a very exciting day to see all of you here, and all of you care about the same issue. And we certainly hope this will be a productive day for all of you, and for our patients, our friends, and families. The weather's pretty bad out there. I was telling Dr. Gwande, we just want to make him feel at home from Boston. So there are people still going to come in, and certainly because of time, I don't want to wait anymore. I expect really a lot of people here, maybe filling this auditorium, and I know that we have close to 1,000 people registered, whether it's webinar, et cetera. It simply tells you that how important this issue is. So feel free to share your thoughts and tweets throughout the day at #IOM End of Life. Right? Everyone you tweet, right? Of course. So for those who can watch every session, we post the videos online, so you can check back in a few days to watch them. For me, it's really, really inspiring to see so many of you, so many people in one place who care so deeply about this issue that affects all of us, personally and many other different ways. You know, many of us have dealt with the family members, friends, during their last days of life, and it's a tremendously difficult experience. And all we need is, in fact, we need as much support as we possibly can as we prepare to part with our loved ones. So because death is such a personal experience, it can often be a very difficult topic to approach. And we all know there's a lot of controversy surrounding the end-of-life care, which was particularly, as you know, politicized during the passage implementation of the Affordable Care Act. But we cannot let our discomfort and discussing care during dying lead us down the path of inaction. We have to act. Today in U.S., we are culturally diverse. Look at the people in this room. Look at myself. And we require patient-centered care, culturally sensitive care, to understand individual preferences. This is especially important during the last days when we see servicing unique family structures, traditions, religious belief, comfort preferences, emotional and mental and physical needs. We also have extreme health disparities. We all know that. There's still a lot of work to be done in this country. And these extend right into the access and the use of hospice and palliative care as an example. And the number of older Americans, as you all know, who are frail, have physical or cognitive disabilities or chronic illness is increasing rapidly. The number of individuals over age 65 was 39.6 million in 2009, and in 2030, this number is expected to be around 70 million. So it's a huge rise in terms of our population. I think all of us would agree that our current system is not equipped to deal with these challenges. In the last century, death has evolved from a common family event to a medical event. And too often, communication between patients, families, and clinicians is weak. And patients don't die in the manner they prefer. And many die in circumstances that do not reflect their own preferences or their own values. And we all know that our service delivery system is highly fragmented with poor support, lack of payment incentives, poor coordination across programs. As a physician, and having practiced many years of my life, I certainly have seen that and experienced this repeatedly. As a member of a family, I've witnessed that as well. So there are just too few palliative care service specialists, and the knowledge among clinicians is clearly inadequate. So aligning practices, public policies, personal preferences is going to be really, really important. So I think this is why I'm so excited to be at my job, because this is what IOM cares about. And earlier this year, we released a report, as you can see, called Dying in America, Improving Quality and Honoring Individual Preferences Near the End of Life. And I'm going to introduce Dr. Phil Pizzo, who's a co-chair on this report, and
Judith Perez, and a number of other people who've been members are also here. I just want to thank them for the great work they did, because really, independently, they navigated this very difficult issue and put forth some recommendations that I will tell you everybody can embrace. So far, the amount of response has been so robust. Now we want to see some actions coming out from this report. I also want to point out, of course, that there are really lots of staff who work so hard at this. Adrian Stiff-Butler, Stephanie Pincus, Lawrence Scher, Bradley Akert, and Thelma Cox, and I want to thank them as well. Now, as you know, in our work, a lot of our work are commissioned by the government, specific by Congress or by the agencies to work on a specific topic they need recommendation. This is not one they ask us to do. Increasingly, I feel that as an organization, we got to reflect what the public wants and really find every way to move topics forward, which is why many of you know I've been on listening tours throughout the country, talking to people and asking people what matters to them and what we should be doing. This is an example. This is a topic, an initiative undertaken by IOM and funded by an anonymous donor who funded this but have no hands on how this is being done. But I think the person cared enough about this to say, you're right, we've got to do something about this. I believe this is the most comprehensive report to date ever been performed around end-of-life care. That's not to say the work you do is not important. You've done so much, and we've learned from all of you. And I think that in this report is if you look at our report in 1997, Approaching Death, Improving Care at the End of Life, life has changed so much, if you will, pardon the pun, in terms of everything that we face in our society. So I think this report captures what we see in our fragmented health system, and challenges that lead to sick people being moved from one place to a place with little regard for their preferences. And it discusses how policy and finance show incentive perpetuate some of the models that need to be changed to work for the patient. I think it is certainly time now for the nation to develop a modernized and end-of-life care system as envisioned by this report. This report will require changes in financial systems, organization, communication, and culture by payers, providers, clinicians, social service providers, families, and patients all together. And this is why it's so amazing that all of you are together, because I know you all want to make the right changes. So the recommendation to put forth the report, I thought the committee, Phil, thank you, Judy, really was so well thought out. I know it was not easy. I heard about this, but eventually when it came out as a report, you can see we have not had anybody who says, well, this is a death panel, we can't deal with this. In fact, I think there's people embracing what great principles. We all want to do the right thing. So let's go ahead and try to change these things. If medical social service were better integrated, we would do so much better for our patients. And potentially, we can save money. So that's not the driving force, but that will be a great outcome as well. Palliative care services, including hospice, improve patient outcomes and may reduce also health costs and lessening the use of acute care services. So, IOM report asks many of you, all of you, to play a role and all of you to move forward together. We certainly today we have private insurance here, Medicare's here, government legislators are here, and we need to talk about today legislative changes and financing changes, particularly of medical and social services. So we will talk about that more, so I'm not going to repeat all those things ahead of time. I think you'll hear in a few minutes the report's recommendation. But first, I just want to tell you about how important it is that you're here today, important to me and to all of us. So let's talk about today's purpose. Actually only 10 days ago in the same room, the Coalition to Transform Advanced Care, CTAC, was here as well. And I say this, I felt that momentum when I was with them and now today, because we all want to work together to improve advanced illness care. And there's a lot of work to be done in policy issues and many others. So as I said, we want to bring key players together today, and we want to have a comprehensive approach to this. We want to be able to walk out of this all committed to the same cause. And as I show you now, we've already had people sending us statements of commitment. That's amazing. We have like 50 organizations that says, we will do these things. What I'd like to be able to do is to be a catalyst, to be able to use our convening power to bring people together, to keep moving on this. But you know, it's your work, it's our work together, and IOM knows who we are. We really are a place where we want to do evidence-based report, convene people, and help people to move along the agenda. So I just want to thank everyone for being here, and so many people who's make this possible. And I'm just going to simply say to you that, you know, there are so many people in my staff who work so hard on this. I already mentioned some of them, but I want to single out Abby Meltzer, Lauren Schern, and Laura Stefano for their hard work and for putting this together. And of course, we are not done yet. What we hope to do is to continue thinking about what we can do next, including the potential creation of a toolkit that can be used broadly, you know, on behalf of IOM, for our patients, for our providers, etc. So with that, I want to turn the mic over to Phil Pizzo. You know, I mean, Phil and I have known each other for a long time, back in Boston days, and I was so pleased that he took over the helm at Stanford, where is one of my alma maters, and he's done a fabulous job. But you know, Phil's interest is so broad. Not only has he been focused on innovation, you know, integrity, education, etc. He's actually taking on a number of topics, this being one of them, and I'm grateful to him. The other co-chair is David Walker, who was very sorry that he couldn't be with us today. He had to attend a family health concern, and of course our thoughts are with him today. So let me introduce Phil, who of course does not need any introduction. Phil served as the Dean of School of Medicine and the Carl Elizabeth Naumann Professor at Stanford School of Medicine from 2001 to 2012. He's currently the founding director of the Stanford Distinguished Careers College and the David and Susan Heckerman Professor of Pediatrics, Microbiology, and Immunology at Stanford. As I said, as a pediatric oncologist, he's had a wealth of experience of taking care of patients, doing clinical trials, and of course, working on policy area. He's devoted a distinguished career to the diagnosis, treatment, and prevention of childhood cancers and infectious complications that occur in children whose immune systems are, of course, compromised by cancer and AIDS. So Phil and David's bio-sketch are all available online. You can look them up. And I just want to first personally thank Phil and give him a round of applause, and to Judy Perez, and if I'm missing anybody in the committee, forgive me, but I thank all of you for doing just a great job. Thank you.